much. Thank you. I am shocked to see this many people here, and so I think that's such a lovely um thing to see with that this many people are interested in this topic because it's something that I'm so passionate about, and it's something that we don't often get to talk about at kind of huddles and events like this. So thank you, Rachel, for the opportunity to talk about it.
My pleasure.
Um, but I am a new consultant in public health, so I started working my first job after doing the training scheme on the Isle of Wight Council back in September. I'm looking at the list of people, and I think there are some names that I recognise because I trained in the West Midlands, which is how I know Rachel, and why I was so keen to come back and talk to people because I love keeping those links going. Um, but I am here with Sophie, who is an analyst in the data intelligence team, Isle of Wight Public Health team. Unfortunately, we're losing Sophie. She's leaving at the end of the month, so this is her swan song before she goes and off to a senior analyst job, which she richly deserves. But that I'm very, very sad to lose her from. So I started working on the 1st of September, and I have a quite a broad portfolio for a consultant. So because there's only myself and one other consultant under our DPH, I cover drugs and alcohol, health protection, gambling, data and intelligence, oh gosh, mental health and wellbeing, suicide prevention, emergency response, and also domestic abuse. So this is part of my role, but I'm very, very importantly supported by my domestic abuse lead, who's called Laura Johnson, and Kirsty Butler, who works in the team. And both of those people are fantastic. And they've taught me a huge amount since the 1st of September because I didn't do domestic abuse when I was working in the West Midlands. It's something that I've had to learn very quickly since I started moving down here. The first thing I learned is that only 13% of local authorities have a domestic abuse team within public health. In other local authorities, it sits elsewhere. So this is something that I had not had the opportunity to work on before. And also, we're always looking for peers who also have DA within public health because I think there's so much that we can learn from each other. Yes, that's basically who I am. Sophie, could you move to the next slide, please? That would be lovely. Brilliant. So for those who don't work in domestic abuse, this is the definition of DA from the Domestic Abuse Act 2021, which is essentially what we keep going back to all the time because it provides our statutory guidelines. It says what we have to do as a local authority, and it also provides this definition. I did want to kind of make this session quite interactive, but I think that might be difficult with the sheer number of people. But it'd be great if I could get a hand raised from people who work specifically within DA and have a DA background, just to kind of see who's in the room. If you could just sort of raise your hand, Catherine, David. Yeah, so we've got lots of hands raised. 10 hands raised at the moment. Okay, that's brilliant. And then if those hands could go down and I could get hand raised from people who don't work in domestic abuse at all and have come here because you're either an analyst or this is something you want to learn, it'd be really good just to see the split. Probably a bigger majority. Okay, that's yes. So a slightly larger majority. So I am going to go into a bit more detail around the background of DA because I think, like I say, it's something that was totally new to me, and it looks like that's a kind of majority in the room. So this is the definition, and it's interestingly nuanced, and I think that's something that we had to really bear in mind when we did the analysis as well, because it's some caveats which we then had to feed in, which Sophie will talk about a bit later. But the behaviour of a person towards another person is domestic abuse if both of them are aged 16 and over, which is sometimes something that causes some problems in the data and are personally connected to each other. So it doesn't have to be an intimate relationship. It can be parent to child, it can be brother to sister. There's all those different relationships. You just have to be personally connected. And that's something that we also want to really make sure is very clear from this, because a lot of people think of domestic abuse as intimate partner violence, and it's much, much broader than that. And some of the data that we have, which Sophie will talk about, allowed us to look at those other relationships, and it was a large minority of the data set included people who had other relationships to intimate partner relationships, and B, if their behaviour is abusive. But abusive is quite a large term, so it doesn't just include physical abuse, it has all of these different subsections. So we have physical or sexual abuse, violent or threatening behaviour, controlling and coercive behaviour, economic abuse, which has its own kind of list of caveats, and also psychological, emotional, or other abuse. So those of us in the room who have an analyst background are probably already looking at this thinking this is something that's going to be quite difficult to put into a data dictionary or to easily define across different data sets. And that's something Sophie will talk about, is how much trouble we had not having a very, very kind of specific definition across different data sets. And I think it's really important to keep coming back to this definition of domestic abuse because it underpins absolutely everything we do. The final line as well is important. It doesn't matter whether behaviour consists of a single instance or a course of conduct. And again, that's something when you look in the police data, you have to make these really nuanced decisions about across different cases versus different incidents. Next slide, please, Sophie. So in the public health team on the Isle of Wight, we have, as I said before, Laura and Kirsty. They are responsible for commissioning our two services, which we have, which are relevant to DA. So we have our Paragon service, which is our main service for victim survivors of domestic abuse. So that includes refuge, it includes other dispersed accommodation, it includes some counselling, and some kind of broader training offers. The other thing that's also vital in DA is services for people who use harmful behaviours or people who are causing harm. We commission the Hampton Trust to provide courses for people who fall into that category. That is absolutely vital for preventative work, though it's something that isn't talked about as much. It's something that I want to highlight, is something that we also commission, and that's so those are our two key services. Next slide, please. So just a summary of the duties on the local authorities. So these are the key duties which are relevant to my team. We have to have a statutory domestic abuse partnership board that has to include people from local authority, but also from the police, from the commissioned services, and a broad range of other partners who come together to ensure that we're providing the best possible support for victim survivors and other affected people within the Isle of Wight. We convene that board every quarter. We also have to provide support to victims, survivors of domestic abuse and their children in refuges and other safe accommodation. We have to assess the need for domestic abuse support in the area and to ensure all of our policies are written and carried out in such a way to be inclusive of the whole definition of domestic abuse. Sophie, next slide, please. But the reason it's so important to work with our data team and to really look into what we can do to properly understand what is actually going on is this duty, which is a statutory duty, the need to assess the need for support in the area. That's why we did all of this work. That's why we continue to dig into the data sets to try and understand the need, because it is such a hidden problem. It's not something where you can just go to fingertips and get off an indicator that's agreed across the country. It's something where you really have to do that initial and very detailed local work to understand what your specific need is, in not only in terms of numbers, but also the sorts of communities who are affected, the sorts of people who need different refuge support. So, for instance, are you looking for accommodation that will mostly take single women, families, people with pets? people with older male children, that can be very difficult. Who is it who you need to support within your local authority? So to talk about the data, I'm now going to hand over to Sophie.
Hi everyone, thanks Nicola. So just to give a bit of context to my role, so I've been working with Nicola since September, but I've been in the Isle of Wight Public Health team since August 2022. So a bit of background to our team. So we used to be in partnership with Hampshire and the Isle of Wight Public Health team until September, when Nicola and quite a few other people joined our team. So because of this, our team sort of structure changed, and the opportunity came up to take on the domestic abuse portfolio from the data side. So like Nicola, from September, domestic abuse was a brand new portfolio to me. So all of this is just my learning and reflection. I definitely am not an expert in domestic abuse by any means, but I have learned a lot in this process. So it'd be really great to share with you the journey that Nicola and I have been on. So like I said, so sort of scoping the work and understanding what was needed from the data team. So understanding the previous work. So there was a domestic abuse Power BI, which was created during the Hampshire and Isle of Wight Public Health Partnership. Following the ending of the partnership, this tool was no longer available for the Isle of Wight portfolio. So what I did, I, with Nicola and the rest of the team, attended the Domestic Abuse Partnership Board. So in this, I got to meet a variety of the different partners involved, and that is probably one of my biggest reflections so far. Having worked in public health, the amount of different partners and stakeholders involved in domestic abuse is very different to other public health portfolios. So it was really great to meet them and understand, like Nicola said, the different commission services, and to begin to understand the types of data that might be available and suitable for the group. Unfortunately, we were not able to go ahead with the planned Power BI dashboard. So because of the sensitivity of the data that would be included, this would need to be a private Power BI. And unfortunately, that option wasn't available to us. So in the end, we agreed on a slide set that would be privately distributed just amongst the board and not for onward sharing. So that was a first hurdle. Unfortunately, we couldn't quite get sorted. And then it was really to understand how data could be used within the DAPB board. So really, after discussions in the first meeting, it was really a tool that could be used to support the monitoring of progress against their strategy, and something that could be used sort of at the beginning of meetings to set the tone of this is what's happening in terms of data we have recorded. And of course, data doesn't tell the full story, but it tells us what's been going on in the recent quarters and years. So that was the initial scope. So then we began to break down the three pillars of the domestic abuse strategy. So the first one is prevention and reduction of harm. The second one is increased access to specialist support. And the third one is collaboration and working together. So through working with the board and closely with Nicola, Kirsty and Laura, I began to understand the types of data sets we would have access to that would support these three pillars. So in terms of prevention and reduction of harm, like Nicola mentioned, we have access to the Hampton Trust, which is the Isle of Wight service for persons causing harm. We also have some information about the uptake of multi-agency domestic abuse training. And we also were able to obtain data on right to know and the right to ask, which is part of the domestic abuse disclosure scheme, which we'll talk about in some later slides. The second pillar, which is increased access to specialist support. So we're able to look at police data where we could look at recorded domestic abuse crime. I'm not sure how many people in the group are familiar with police data, but not to worry, we're going to go into some of the strengths and the caveats of using that in a few slides' time. We also have access to Paragon. So like Nicola said, this is the Isle of Wight service for those subjected to domestic abuse. And the last thing is Marek and Herder meetings. And again, this will be discussed in a few later slides, but the goal of these meetings is really to ensure families that are affected by domestic abuse receive a timely response, and interventions are put in place for their safety. And then the last pillar, which is collaboration and working together, we hoped that the slide set would demonstrate, pulling all of these different partners' data together. And of course, the DAB board in itself is working towards that pillar. So that's the only one we didn't have any quantitative data that we could use to illustrate progress towards that. So now I'm just going to spend a bit of time going through the different data sets, and do please feel free to ask questions. It's a lot of probably unfamiliar data sources, as it was to me when I first began. So I'll try to describe them as best I can. So in terms of the first pillar, we have prevention and reduction of harm data. So like I mentioned, this was the Hampton Trust, which is an Isle of Wight service for persons causing harm. So this data is available quarterly. Due to the sensitivity of the data, we had decided to only present this at a yearly aggregated method, and we felt that referral demographics of this specific group were not appropriate to be shared. Also, what's really important to bear in mind is this is not a representative sample of people causing harm. These is as people that are causing harm and then have sought help through the Hampton Trust. So again, it's looking at a very specific proportion of the overall people that are causing harm, which was the reason we didn't want to drill into referral demographics, which may cause a skew in the data. The second was the uptake of multi-agency DA training. So this again helped us to understand who was attending the training and the reach of the training across different organisations. Again, with this data, it was a bit difficult to understand the denominator. So in turn, we knew how many people were attending the training, but we weren't sure what percentage of the ideal workforce that should be uptaking this training were. So again, this is where it was very important that we start to build up that trend analysis, so we can start to see over the course of years how many people are attending, and if we start to see an upward trend in that attendance. But it's quite hard to find out. In an ideal world, we want a figure that says 100% of people eligible for DA training are attending, but unfortunately that is not available to us. But we are able to see who is uptaking the DA training from different organisations, and perhaps from that we can improve our reach in terms of maybe comms to certain different providers, or if there's a gap or it's not getting through to them. So that has been helpful for partners. So I mentioned the right to know and the right to ask. So this is came about because of Clare's Law, which is a domestic violence disclosure scheme. So the right to ask is a principle that empowers individuals, families, and communities to request information, support, or action from services where they have concerns about safety, well-being, or outcomes. So the right to ask allows a person to make an application to the police if they are concerned that a partner or someone connected to a family or a friend may pose a risk. And the right to know is slightly different. So this forms the second part of Clare's Law, and it allows the police to proactively share information with an individual where they identify that someone may be at risk of harm from a partner or a former partner. So this means they don't have to submit a right to ask application. The police make this disclosure directly to them. So in terms of the data that we have a count of applications, but what's really important is not all right to ask requests will end with a disclosure. So from the data, we're not able to ascertain how many right to ask applications did result in a disclosure. So it's difficult to understand how Clare's Law is helping to reduce future harm in that respect, but we can see how many people are wanting to request that information from the police. Moving on to the second pillar, which is increased access to specialist support. So the main data set is the police recorded crime data. So I'm not sure how many people are familiar with crime data, but the sort of fields included is the type of crime, which is categorized in a hierarchy tree. You have the relationship of those causing harm, the date of the crime, the date the crime was recorded, and then there also is a DA flag. So what we're able to do with this analysis is trend analysis across time. Um, Interestingly, especially for domestic abuse, is understanding when the date of crime occurred compared to the recorded crime date. So by this, I mean when the person experienced the crime versus when they went to the police and recorded that crime. That was something when we began the analysis, I didn't quite understand the importance of those two different dates. And actually, when we're wanting to look at trends across different periods of the year, we're wanting to be when that crime actually occurred rather than it was reported, because there can be delays, obviously. So that was something that was really good learning for me. I hadn't ever really used crime data before. So that was a good reflection. If you do start to use crime data, you can just do a little bit of analysis to understand the average days between those two dates, and it can be important in terms of your analysis if you're having large gaps between those two numbers. Also, the types of crimes occurring, violent crimes, etc., as well as the relationship dynamics. So Nicola alluded to a few caveats with the crime data. So like I said, we have a DA flag. So going into this analysis, I began by using predominantly yes, where the DA flag was. But then through some sort of QA of the data, we found that where the relationship was intimate and the crime was violent, yet there was no DA flag. So after this, we became very clear with our messaging that when we were the language we would use. So we made sure when we presented it back to the board that this was the recorded number of crimes with a DA flag. And we have began some further analysis into crimes where we feel a DA flag is appropriate, but it hasn't been recorded. But obviously that is a very large piece of work. Also, it's very difficult when there is a DA flag assigned to the crime, but it would appear to be non-DA related based on the definition that Nicola provided. So we are now in a process of trying to cleanse the data as best we can to try and provide a truer estimation of the recorded DA crime on the Isle of Wight. And of course, it's really important to highlight that this is only recorded crime. We know the true impact of domestic abuse will be higher. So that's why it's really important that we can, as much as possible, identify within the crime data crimes that are truly DA, so that we are getting closer to the true recorded DA crime number. And the second is Paragon. So that's our local domestic abuse commission service. So it supports those subjected to domestic abuse. So again, this is based on referrals into the service. So this looks at things of risk level of the referral outcome, and the referral source. It also looks at the characteristics of those referred in terms of their age, sex, ethnicity, and their presenting needs. And this begins to help us to understand about the people subjected to domestic abuse and have been referred for help. One thing just to caveat is not all those that are referred will engage with the service, but the analysis we can do is based on all of those referred. So we're unable to do any sort of analysis in terms of differences in people that may engage with the service and not engage with the service. So that's just something to bear in mind when you're looking at this data. It's always based on the number of referrals. Just because somebody is referred into the service, it doesn't mean that they will then engage with the service. So that's just something important to consider when you're looking at those counts. That doesn't mean that all of those people have then gone through the service and been supported, for whatever reason it may be. And the next is the herder and Marek meetings. So herder meetings consider and triage the highest risk of domestic abuse incidents, and MARICs are a multi-agency response for high-risk domestic abuse victims, where up-to-date risk information is combined with an assessment of the victim's needs. So it enables appropriate services to be put in place. So with this, we record the number of cases presented at these two different meetings. And again, it allows for identification of trends across time. From someone who is not from a domestic abuse background, when I received these figures, it is quite difficult to interpret because you need to understand the context and the trend behind these numbers. I know also this data, it will vary across the whole of the country because the frequency of these meetings also varies. So you can't just look at the figure in isolation. That's where the trend analysis becomes really important. And it was really helpful for me in understanding. I had no idea the sorts of counts that would be occurring for this. So some of the reflections of working in the domestic abuse portfolio. So the largest one is those, we're just seeing the tip of the iceberg with all of this data. So the data we have access to is really those reporting DA to the police and those that have been referred into a service for support. We know a lot of people are not recording or reporting DA. They're not able to seek help. So we really are just seeing the tip of the iceberg. So this is one of the key reflections is when you're writing and about the data and the importance of the clear narrative of what this number represents. It represents police recorded domestic abuse flagged crimes. You end up with quite long definitions of the data, but it's just to ensure that that figure is not misinterpreted. And for all of our data, we know that the true figure is higher and that these are just estimations, which is quite common in a lot of public health data that we use. You know, it's based on maybe self-reporting or it's based on a survey. But I would say for domestic abuse, I felt when I'm looking at the data that I'm really only seeing a very small proportion of the true story. So that's just something really important to keep in the back of your mind when you're writing up the narrative. Also, what's been really interesting is the number of partners working together. And that's been something really great as an analyst to be involved in. And like different specific perspectives of the work they do and who they're working with to reduce domestic abuse and support those affected. So that's been really interesting to be working closely with partners. Nicola also alluded to this. I think as an analyst, I'm quite used to fingertips. I can go on. I am 100% confident in the data definition that I am looking at. I'm confident in the numerator and the denominator. And I think this is something that's been challenging when it's data collected by lots of different partners. It's just making sure you build those relationships with partners and take that time to really understand their data and the definition that they have used, and not to make assumptions about what that might mean. So I would say in the sort of scoping part, it did take quite a bit longer because I'd have quite a bit of back and forth.
Just wait for the bus home. We've had signed release forms.
Hi everyone. Could you just make sure you're on mute, please, so we can hear the presenter? Thanks very much.
I would say in the scoping element, you need a little bit more time to understand the definitions compared to a standardized data source, which we would use regularly. Like I said, different services will collect different types of data and collect them in different ways. So you'll be looking at data which is collected and stored in different structures. So again, it might just take a bit longer to do that analysis compared to formats we're used to regularly using. Also something is, again, we're used to having a comparator, whether that's the Southeast, England, nearest neighbours, and with this data we don't have that comparator. The comparator really is using a rolling trend analysis to understand what's been going on locally, as well as those defined denominators. Quite often we're not sure, it's a count, but we're not sure what that count is out of, what's the pool of people we're looking at. And quite often, like I said, with, for example, those reporting to DA, we know that this is just a small proportion of the total people that are being affected by domestic abuse. So DA does sit within public health for us, but it can be isolated from other public health portfolios. And actually, there's a lot of intersectionality, and the team have been working really hard in terms of people that are affected by domestic abuse and other characteristics that they might need support with. But I would say it's a really, really interesting portfolio to work in, very, very rewarding. In terms of data, it's very different to any other sources that I've ever worked with. And yeah, if anyone has any questions, I think we've got a final slide to wrap the presentation up.
Yeah, that's brilliant, Sophie. Thank you. So I'm just going to talk very briefly about what we want to do with this data before we open up for questions. So as part of our statutory duties, we need to create, yes, thank you, Sophie. I can see some claps. We need to create a strategy. So we have the Isle of Wight domestic abuse strategy, which goes through to 2029. And we also have the implementation plan, which gives more detail around what we actually want to do on the island and how we're going to get to where we want to be in 2029. We want to make sure that we're continually reflecting the evidence base, and we are always based in data and intelligence and insight from our local area. So all of the data that Sophie's talked around today is going to feed into both of these documents to ensure that we are providing services which meet the needs of our specific populations in terms of their demographics, whether they've got kids, whether they've got pets, etc. But also making sure that we improve that data quality, and we work together through the board to talk about things such as coding, trends, recording different characteristics in our various kind of sub-meetings, so that all of that can be brought together to properly move to a place where we will have a really robust DA data set for the whole Isle of Wight. So there's multiple strands of that and where we want to get to. But it's a long road, as Sophie said. There's lots. They're not ideal data sets, and we do need to build up our own trends as we go forward. But that's what we want to do, and that's where we want to get to. And I think we're already starting to see an impact. So yes, thank you very much, everybody. Hopefully that was useful, and we really are happy to answer any questions at all about either the data or DA in general.
That was wonderful. Thank you so much for telling us about your journey. And I can relate to, as an analyst, I can relate to a lot of the things that you're saying, Sophie, about the getting used to a new data set, which was or lots of different data sets, working with lots of different people, which isn't clean, and you have to sort of work things out and be careful how you're interpreting things. And I guess you don't jump to conclusions, and you're being careful, like you were saying, about how to work with the data and summarize the data and so on. We have got a few little questions on Slido, a few comments, and I think we've got time to go through those. So if I just I've got a feeling that the hands up in the room are legacy hands from before, but if they're not, I'll just check that Carol and Nikesh actually don't want to say anything in the room. I'm assuming it was from beforehand, and that they're just still there from before. But I'll just share my screen to let's have a look at the Slido questions that one or two people have raised. So if you're logged into Slido, you can see them, but that might not be. I'm sure Nicola and Sophie haven't had time to do that because they've been busy doing other things, like presenting. So we've got a few questions. These are, I think, shall I just read out one or two, and then you can decide who's best to respond. So the first one here, which has just popped up because they're in as people type them, they appear at the top. So I'll do this one first. So, do you collect any data specific to children and young people, such as Encompass data? So children and young people.
That's a really good question. So there's mentions of children and young people in the data set, so we know how many people, for instance, in the refuge have children. We know some things from the police data, but because of the definition of domestic abuse being two people aged over 16, we don't have a lot of additional data, I would say, and it's probably not where we focused. But Sophie, do you want to say about police data?
Yeah, I would say the focus has been more on adults, but from the data, some of the data sets you can see if it's an adult who is living with children in the household, that's quite often recorded. But like Nicola said, so the definition of DA is 16 and over. So that's something also we've had to bear in mind and do a bit of quality checking with the police data, because we have found there's been a DA flag on someone younger than 16. So that's another part of the sort of analysis process, is making sure we're looking at that age group as well, and to sort of quality check the DA flag.
Okay, thank you. So I'm just now going to look at some of the earlier questions which were put on here, which you might have covered in your in the presentation as it went along. So the one at the bottom was, I think you mentioned that there was an issue with sharing referral demographics. Now I think what you said was that it wasn't representative and it might skew the results. But could you just remind us why you weren't able to do that sort of in-depth look at the referral demographics?
Yeah, so it was also not a requirement for the board that it was something they were specifically interested in. They were interested more in the characteristics that were referred into Paragon, but it is being looked at with my boss, who's taking over the portfolio, in terms of gathering more data. So we have sort of more years worth of data to look into those referral demographics. It's just to ensure that we're increasing the counts. That was the reason behind it.
Okay, thank you. So, and there's a question here. So, working closely with the Isle of Wight, I'm wondering, does the data consider the provision of DA training in own services to internal staff groups? And is it all data Isle of Wight local authority? Is that a question that you understand? Does that make sense to you, Nicola?
Oh, I'm not sure if the caveats around who's being trained, Sophie. Do you know the training data? Does it include local authority staff?
I am just triple checking, but I believe it does include. Yeah, so I have both internal and external to the council within the data. So yeah, it does include the Isle of Wight Council, as well as partners that would still are connected to the council but aren't the council.
Okay, lovely. Thanks very much.
And in terms of whether all the data is Isle of Wight local authority, it is. So that's one of the issues with the police data, because we've got kind of Hampshire and the Isle of Wight. So we've had to work really hard to ensure that Isle of Wight data is sort of separated out in all of these data sets, because some of the organisations work across different geographies. But everything Sophie's been presenting, it has been Isle of Wight data.
Okay. Thank you. Thanks very much. There's a question here about accommodation. So does your analysis include any focus on safe accommodation? For example, do you look at temporary accommodation or refuge, dispersed accommodation usage by those fleeing at DA?
Absolutely. So we're looking to, the next stage of this work is to really strengthen our safe accommodation work. We've just created a new subgroup specifically around safe accommodation. But the Paragon data includes the number of people in refuge, doesn't it, Sophie? Is that correct? And then we've got very small numbers around dispersed accommodation on the Isle of Wight. But is there anything else to add about refuge data, Sophie?
No, like I said, you've got it a bit within the Paragon data, but that's an element. So we've presented the slide set back, the first draft of it at the DAPB board, and that was something that I put as the next steps of that was coming. We just need to work with that data a bit more closely, just to make sure, again, that we've got enough quarters and things to really understand the trends and the patterns. So yeah, that is being worked on in the coming weeks and months.
Okay, thank you. So I'm now just going to read a sort of a general comment before there's another couple of questions for you. We're making you work hard today, aren't we? I mean, you will come
we
back
like
one
it.
day, won't you? The thing is, you've done the hard work, haven't you? You want to talk about it, and then I think it's great that people are so interested and they want to ask more about it. And sometimes I think people find that they come to sessions like this and they think it gives you some ideas, and actually I hadn't thought about that. So I just read this comment from Stoke and Staffs, which is an area that you slightly familiar with, Nicola. So a general comment. This person says, but your reflections very much echo what we're experiencing in Stoke and Staffordshire, as it is a complex picture to work through and to understand effectively. We're making progress, but there have been some challenges to ensure that our board members are aware of this and that there aren't as many clear-cut benchmarks or high-level measures that can be considered in isolation. So in other words, it's a familiar picture and it's very complicated, and trying to pull it all together in a way that is neat and tidy isn't always the easiest thing. So it's sort of grappling really with a lot of we might call messy data. But how would you respond to that comment?
So for me, I think I totally agree with all of that. And the other thing that's really struck me with this portfolio that's different to others is how difficult it is to get those data caveats across. So for instance, before we started really unpicking the data, we would see that people would talk about the number of crimes in the local area. And then as soon as you get into the data set, you start to realize, no, this isn't the number of crimes, this is the number of reported DA flagged crimes, and it can be really difficult to work with, particularly people who don't have an analyst background, to help them understand just how heavily caveated this work needs to be. It's really easy to put out very misleading messages about the numbers and how well we understand the level of impact with people who aren't used to talking in those sorts of caveats and understanding the real nuances of data. It's a really difficult one. It's really difficult to explain to people. You can't just say a number with no caveats. You have to copy and paste the entire long sentence of caveats we've given you, otherwise it will be misleading.
And I think we've all learned that lesson, haven't we? I think we all know, especially people like me who's long in the tooth. A number is which is heavily caveated will be taken as a number by lots of different people.
Absolutely.
Well, this it's on the spreadsheet. This is a number, but it's a highly the whole area is highly emotive, isn't it? And people sometimes I imagine they are involved with this because they care about it, and so it's even more important, I guess, to try and sort of show the true picture so that you can actually do something with the data that you're sort of pulling together, and sort of the rich data that which is pulling data from different areas to make sure that it's accurate, I suppose.
Absolutely. We do have a Survivor Voice forum on the island, which we're really proud of. We run the Survivor Voice forum in-house, and we haven't taken this data to our Survivor Voice forum yet because of the sheer level of caveats, but it's something we're really keen to do, and to work with Survivor Voice to make sure that we're explaining the data in a way that makes sense to people with that lived experience.
I think that's really important. It was going to be my question, actually. Sort of we're pulling together this sort of the quant data, which has been the focus, to make sure that you're collecting all that together in as accurate a way as possible. But to have some sort of qual data and sort of talk, people's experiences, that's also incredibly important, isn't it? To make sure that you are speaking in a language that is understood by, yes, the people who may need to make some changes, policy changes, service changes, but actually that means something to actually the people that we're talking about, the people whose lives are so sort of deeply affected by this.
Absolutely. So the two policy documents that I showed at the end, they were created in collaboration with the Survivor Voice Forum, and they provided lots of feedback on language, on descriptions, on things in the action plan that we may have missed or had too narrow a focus on. And they've been absolutely fantastic. And so Absolutely. And we are doing a needs assessment in the next couple of years, which will be very qualitative. And so we'll include survivor voice heavily in that.
Yeah, that'd be very interesting, I think, just to get that to get the full picture. I'm very animated, I can tell, because I'm going like this. I'm very interested. I think we've got time for one or two more questions before I before I close. So the next question is coming right back to your well, it isn't necessarily about quant, it could be about qual as well. But what do you think are the biggest gaps in the data or evidence base at the moment? So this is so I suppose in relation to the Isle of Wight and the work that you do and what you've experienced, but equally it could be broader than that, I guess. It is a big question.
It's huge. So there's lots of things I would love to know that I don't know. And it's only when you go through the data that you start seeing more gaps. So just the other day we were talking about the Clare's Law data, and we realised that I think nationally it's about 50% of applications result in disclosure. And so the fact that we didn't just have that to hand for the local area, you're always meeting things where you've got more questions. So I think I in answer to that, so many questions. I want to do more to see how we can understand what we don't know. That's a really difficult one, but I think that we know that this is so underreported, and we know it takes so many incidents for people to come and report to the police and to access services. So things around trends as to how many times people have reached out before we see them going to Paragon would be really interesting, because then we might be able to estimate how many people are not reporting at the moment and how to support those people to report. But Sophie, do you have any particular kind of responses to that question?
Yeah, I guess the biggest gaps we currently have are fully understanding our crime data at the moment. I think there is a lot of more sources of data we could probably include, but I think the biggest gap in our analysis per se at the moment is really understanding the true number of recorded DA crimes as opposed to the number that have a DA flag, and understanding the differences. I can see that someone asked about sort of how we're going to improve that data recording going forward, and I think it's really difficult, and that's something we're definitely going to try and approach. But the issue then comes when you have the change in recording and it will look like an increase in DA flagged crime when actually it's an improvement in the recording. So we just need to think about how we then present that data, again, with a lot of caveats and explanations of why we're seeing this increase. That's something I know Nicola's definitely got on her agenda moving forward, because it's really important that the data we do have, it's as accurate as it can be.
Absolutely. And Rachel, I just wanted to I'm looking at the things that are coming up, and I know we've only got a couple of minutes left, so I just wanted to speak to the issue of before and after 16 and children being victims in their own right. So absolutely. The DA Act mentions it talks about children being victims in their own rights, but children were previously thought of as observers rather than victim survivors, and that's the really important nuance. So the DA Act still says that it's a DA is between two people aged over 16, and whether that will change in the future, because I also absolutely agree with the comment that there's absolutely nothing to say that two teenagers in an intimate relationship cannot be experiencing DA. I totally agree. But the big change has been around children, has been recognising that children aren't just people who see domestic abuse. That seeing of domestic abuse between two adults is making them into victim survivors, and they need to be recognised as people who are harmed by DA as individuals. But that complexity around that definition, we were coming at it from a definitional point of view with the data rather than from a kind of philosophical point of view, and trying to make sure that we were accurately reflecting the DA Act in the complex data sets rather than kind of pushing for change in the law, which is a separate piece of a separate discussion, I think.
I think, yeah, thanks very much for picking that up. And there's a few points in that. We have hit 12, but I think we'll just, if I just sort of, I don't want to run away too quickly. So I would just like to say to people who are still here, and hopefully my lovely guests will be happy for me to send them some of these questions that we haven't managed to get to in the chat today. We really appreciate it if you could have a look at those later in your own time and maybe sort of respond to those, and then I can share them back with the people who've come on the call today. Because there's some really interesting questions, and we could talk about this all day, is what I'm realizing.
Definitely.
But I would normally sort of talk about my next huddles, but I'm going to do that via email because everybody loves my emails, I'm sure, all the time. But I just would like to say thank you so much, both of you, for coming today. I've really enjoyed the session, such a fascinating, interesting, an important topic that you're covering, and you're doing a lot of good to be able to and I love your passion on this as well, because that will no doubt flow through to what people are able to do about this to help improve the situation for a lot of people. So thank you. I do hope you can come back one day and maybe give an update on how you're doing with this, or some of the other things that you're getting involved with. So I will I'll shut us down. I will stop now. So thank you both, and thank you everyone for coming. And I'll see you in a couple of weeks, and approximately minus an hour, and enjoy the rest of your day. Thanks both. Thanks everyone. Bye bye.
Thank you for having us.
Thank you for having us.
That's a
Bye.
pleasure. Bye bye. Bye bye.